Hi, I'm Michelle Adebato. The North Ward Center is committed to educating the public about the importance of community programs that give all New Jersey residents a chance for a better life. That's why we're proud to support the important educational programming produced by the CAUCUS Educational Corporation.
Understanding and dealing with the age wave. Next on CAUCUS New Jersey.
Funding for this edition of CAUCUS New Jersey has been provided by New Jersey Sharing Network, dedicated to saving lives through organ and tissue donation. The North Ward Center, Valley National Bank, Delta Dental of New Jersey. Everyone deserves a healthy smile. The Port Authority of New York and New Jersey. KESSLER Foundation, changing the lives of people with disabilities. And by Suez, water solutions to meet tomorrow's environmental challenges. Promotional support provided by Commerce and Industry Association of New Jersey. And by Insider NJ.
Welcome to CAUCUS. I'm Steve Adebato. You know, over the next 10 years, New Jersey and the entire nation will be experiencing something called the age wave, a dramatic increase in the oldest population. Here to discuss what actually needs to be done to prepare for this most significant change, we're joined by Phil Scalo once again, who is in fact the president and CEO of Bartley Healthcare. Dr. Prisco, president of university we know very well, Felician University. Pamela Madas Snyder is an elder care attorney, and Dr. Kenneth Faistl is a family practice physician. I want to thank all of you for joining us. And we've had this conversation on the air, offline for years. You and your colleagues at the university, very involved in these issues. What exactly is the age wave, and how seriously are we dealing with it in society? Loaded question, I know.
Yeah, and not several parts to this, right? We know as and it's a demographic trend that 10,000 people a day are turning 65. So this is the 10,000 a day. So this is sort of the older half, if you will, of the boom generation. And I'm sort of in the second half of that, so I'm watching all my older brethren
right? Exactly.
face this, in addition to many of us have dealt with these issues for our own parents. So when I arrived at Felician 6 years ago, and it was so obvious to me that healthcare was one of our fortes always, something very much as a Felician Franciscan institution we cared about, and the life cycle. And so how could we address the gaps that we were facing in this notion of healthy living and healthy aging? Sure. So I, along with some partners at the institution, talked about starting an institute for gerontology. We're very fortunate to have people like Phil Scalo.
Phil's been very supportive with his organization.
Up, right, as is Dr. Ken Faistl, who's also on our board, and I'm happy to meet our elder care attorney. And
it does take a village, doesn't it?
And this is what is the most fascinating, is when you start talking about this, you realize it's such a multifaceted issue. It's everything from, yes, the actual medical health of someone, to their life situation, their financials, the environment, lots of aspects.
Phil, let me bring you into this. We've also talked, you've been with us before. The government, someone says, oh, the government, we got Medicare, we got Medicaid. We're set up for long-term care, you say?
No, we're not. As simple as that. On the Medicaid side, as we know with the fight over the Affordable Care Act, a lot of the expansion was based upon Medicaid. The amount of people that are becoming in this age wave is Medicaid, and the states are going to have a difficult time handling it. On the Medicare side, you have the same issue. How do you best pay for the kind of care people do need? There are some programs now where they're looking at patient characteristics as far as dealing with that, not a fee-for-service any longer. So over the next 5 years, we're going to see some fundamental changes in how the government reimburses. And the other part of it is people don't realize that the government is not going to pay for all of your health care or your senior needs.
That's not a cure-all. That's not a solution.
It's not a cure-all because, for instance, if depending on your economic status, if you need to go into assisted living or need to go into a skilled nursing, you may not qualify for Medicaid. Most people will not.
Based on economics.
Based upon economics. And then from the Medicare doesn't cover a long-term care stay, doesn't cover assisted living. It covers what would be the immediate need with a hospital thing and then a rehabilitation.
You know, it's interesting, Phil mentions long-term care, and I've done a disservice because we have not defined what that means. Define it, doctor.
Well, I think long-term care is the transition from the ability to care for yourself at home into some other living arrangement where there is additional assistance and help to try to provide them with safety as a primary concern and their medical needs. You know, my mom and dad were both, you know, middle-class people, lived in their own home. Father was a fireman, mother was a nurse. And then subsequently, you know, dad started to have difficulties where he was tripping and falling. Right. So I'm the only doctor in the family, so I was the bad guy who made the decision that they had to go into some kind of living
You made
facility.
the call.
I made the call for them, you know. I think my father used to come to me as his physician all the time. I think mostly because I didn't take any copay from him, but
that's not a solution for everyone, just in your family.
Right. And so I think he began to realize that he couldn't care for the house and the way things were going, and made a decision to put him in an assisted living facility that had their independent apartment first, and then transitioned to that with was for them almost long-term care insurance.
Let me ask you, Pam, as you're listening to this, there are a whole range of financial problems. Phil was laying it out as well. From your perspective, when do people come to you with these issues, and how does someone in your position, an attorney, help them?
Well, unfortunately, most people come to me too late.
Define too late and define what's a better time. By the way, throughout this program, we've been obviously collaborating with Phil and Dr. Prisco for a while on these issues, trying to educate folks, because you do check out all the listings out there. I know there are a lot of reality shows. You do not see a lot of programming on this subject. I'm not trying to pat us on the back. You just don't see it. So that being said, we're trying to provide valuable information. Go ahead.
And that's the best thing, is to educate people that the earlier you see an attorney or a financial advisor, the better it is. To ask, how do I afford to pay for long-term care? Medicaid, which most people think will automatically kick in once somebody needs a skilled nursing facility, has very strict financial criteria. And there's a 5-year Medicaid look back, and that means—
Whoa, can't use jargon. Look back means?
Exactly. Look back means that when you make your Medicaid application—
To the government.
To the government, you actually do it through the County Board of Social Services.
Okay.
They will look at your bank statements and every financial deposit and withdrawal that you have done for the last 5 years.
To prove what?
To prove that you, according to the government, you did not try to hide any money. Now, that hiding of money is a very different term to the government than it does to regular people.
Hold on, hiding money. Someone says they're 75, 80, whatever it is, and they go, hold on, I would like to take my assets and put them in the hands of my kids. And that's hiding?
According to the government, that is hiding.
Absolutely.
Does the IRS say that, or Medicaid say that? Or
Medicaid says that. Even, let's say your granddaughter gets married and you decide to help buy them a home. That is considered hiding money by Medicaid. Let's say you give a donation. When Hurricane Sandy happened, all the hurricanes happened. A lot of people gave donations to different organizations.
How's that hiding money?
Because that's considered an improper transfer under the Medicaid rules.
Steve, what it is that the government's saying you cannot make transfers for the purpose of getting government assistance. And they look at that very strictly. The other problem, and Pam would see too, and we see it in the long-term care area, is that in the access to the Medicaid application is difficult. In New Jersey, there are 20—
Intentionally, Phil?
Well, just think the way New Jersey's set up.
Okay, it's complicated.
Complicated. There's 21 points of entry into the Medicaid system in New Jersey. Every county has its Board of Social Services. So there's no centralized application. You may get a different result in one county than another of how they look at it.
Hold on, time out, Phil. Where's all the coordination?
There isn't any.
Oh, wait a minute. It's no secret that more and more people, give me the number again,
10,000 a day.
65. Government and other entities not coming together saying, top priority, let's coordinate our efforts. You don't see it.
You don't see it. What happens is the Department of Human Services in New Jersey has some oversight of those, the county offices, but the county offices work by themselves. Pam probably deals with this a lot more than I do. But what happens is you can get, for instance, in Monmouth County, you can get one result for the same application. Ocean County, you can get a different result. So from that perspective, too, they try to centralize applications, but it really doesn't work. People come in, and as Pam said, too late. People don't really realize, and it's part of the problem going forward, is that getting services when you've been used to your whole life not needing services becomes a shock for you when you're in your late 70s, early 80s. And as Ken mentioned, usually it's the family and the children that are being involved in that.
Excuse me, Phil. Phil's really raised an interesting issue. Because you talk about the process, you talk about how cumbersome it is, you talk about the lack of coordination, the time. And I keep asking myself, what's happening, Doctor, and I'll come back to you, Doctor, what's happening to the family during the time that Phil just laid out? Right. What's happening, Ann?
Well, it usually falls on us, right? You're dealing with a parent.
We've talked about this all the time. As we do this program, my mom has been the primary caregiver for my dad for a long time, and we get the help we can get, and we're fortunate. But for those who are going through the process that Phil Scalo just laid out, what's really going on for them emotionally, psychologically, and every other way?
Right, and we know that there's a whole series of issues around caregivers and families that we need to address and educate, because typically we're the ones that are trying to put the pieces together for our families when we have our own activities with work and children
living our lives
and feel committed to helping our parents, but don't necessarily know ourselves what all the rules are.
And some of us have the means, many others do not. Jump in and then jump in, go ahead.
So families are pretty good at preparing for death, but they're not pretty good at preparing for the dying process.
Well, hold on. So what's the difference?
So the difference is I have a will, but I don't have a healthcare proxy. I don't have trusts. I don't have a living will. I haven't told people what I want for my end of life to be done. And so a lot of the people who are transitioning to that elderly age group don't want to give up control of their finances, their home, even to their children. And that's just the nature of your relationships.
I'm confused by something. You prepare, and I need you to jump in from a legal perspective. Preparing for death is not the same as preparing for dying.
Correct.
It's not.
That's true.
So I've set up my will. We've gone through this with the lawyers and everyone else. That's preparing for the inevitable.
Correct.
For our children, family, and others.
We all expect that we're going to wake up. We're not going to wake up some night.
Got it.
And that's death.
What's the difference between that and preparing for dying?
Preparing for dying is letting your children know, if I am in a situation where I'm brain dead, or if I have an incurable, irreversible illness.
We have to talk about this?
Absolutely. And it's a very difficult conversation to have. Most people do not want to face their own mortality. But
excuse me, that's not mortality. That's the process moving toward it. It feels different.
It does feel different. And people would rather just think that they're going to go to sleep one night and not wake up. People are terrified with the concept that they are not going to be able to care for themselves. They're used to being the caregiver and the financial provider, and now those roles are being switched, and it's frightening for this aging generation. And a lot of folks have not told their children, these are my assets, this is where I keep everything, and so something happens to the parent, the child is now trying to take care of the parent, and sometimes they have no idea even what banks the parents have their accounts in.
I'll tell you what we're going to do. We're going to have to go to a break right now. We can back. We'll continue talking about this, but and I also want to talk about the fact that you and your colleagues at Felician have talked about the importance of care coordinators, navigators, and their career opportunities here as well.
Yeah.
A subject that is incredibly important, even if it's difficult to talk about. It is inevitable, necessary. We'll be right back after this.
To watch more Caucus New Jersey, find us online and follow us on social media.
Welcome back, folks. We are talking about, we're talking about so many things. To say we're talking about elder care, we're talking about the age wave, it's so much more than that. It is life, it is families, it's a whole bunch of things. Real quick on this before we go to careers. I was just saying that because of the experience we've had with my dad and seeing my mom go through this, and again, that's just a metaphor for, or analogous to so many people out there. I've actually tried to start this conversation with my wife. She goes, what are you doing? I said, I want to talk about how and when. And she goes, but it's too soon. I said, yeah, well, who knows, number one. Number two, and it's no fun. But the reality is I don't want you guessing. I don't want you not knowing. I don't want you not doing what I want. That's uncomfortable, but absolutely necessary, right, Ann?
Yes, but it's uncomfortable.
but necessary.
Yes.
Now let's talk about where people can get some help. You're saying, you've told our producers, and we've had this conversation before, the importance of care coordinators and navigators. What does that mean?
So in thinking through a typical person's even hospital stay, so mom falls, maybe breaks a hip, maybe needs to be in the hospital or have a surgery, then is going to move to some sort of a rehab facility, and then the question is all of those transfer points and all of that care that the person requires, everything from tracking their medication to who's ordering the ambulance to get the person transported. I mean, all the details.
Critically important.
We're toying, if you will, with what is that role really, and what do you call it? What is possibly reimbursable? Because that's always a question by the government for certain families. Can we even afford this? And then for the role of someone like at Felician University would be, okay, let's talk to those who are trying to provide these services and see what skills we can help provide training to them so that they are really equipped to help be these navigators.
You're trying to be very strategic.
Yes, in terms of preparing people and educating them so that they really can have a healthy aging process.
But you're also creating a I don't say marketplace. How do I want to say this, Phil? She's also creating career opportunities. And by the way, I should have given you a chance. The folks at Bartley, what do you do? So that everyone knows.
Well, we're a post-acute care provider, which is we have rehab facilities, memory care facility, and assisted living, as well as skilled nursing. So it's the long-term care. It's everything other than a hospital.
So,
outpatient.
as again, you and Dr. Prisco worked together for a long time. When Dr. Prisco talks about these really workforce-related issues, career opportunities, talk about it.
That's exactly what it is. When you think as that age wave is coming, well, that age wave are the patients and the residents of the facilities or home care. Who is going to take care of them? Just as we had in the 50s and 60s, a big explosion in building schools, and teaching was the great job to get into then. Right now, one of the biggest problems is workforce, getting people to take care of people. For instance, in the state of New Jersey, there's a gap of about 2,000 openings for certified nurses' aides.
Openings?
Openings, meaning
you don't have the people?
Don't have the people. What Felician has done is actually, for the past couple of years, has seen the need, for nursing. The nursing
great school of nursing, but I'm sorry.
And that's where we get involved with that. But training nurses, it's been a big problem.
Is it special training, Phil? Is it different training for the population we're talking about?
It is different training, and Dr. Faistl can probably address that even more than I can. But the difference is that it's traditional nursing that goes back from the Florence Nightingale era. It's not highly technical from that sense. It's getting more technical as time goes on because we're doing more in long-term care facilities than there's ever before. It's becoming like hospitals. But the key thing is that it's that person-to-person contact, because as the person goes into a facility, you want to treat it like it's home. And in order for that to be done, you have to have confidence in the people that are there. The people that you hire have to care. Somebody said to me a long time ago when I asked them, how do you get certain people, and this was on a rehab area, and the answer I got was, we hire people that care. We train them how to do the job.
You can't train people to care?
I've always wondered about that. You really can't.
You can't.
Some people, it's sort of like an old, Casey Stengel once said about a baseball team. He said there's 24 players on a team. 8 are going to love you, 8 are going to hate you. And the key is the 8 in between. Can you get them to love you? And you can hire people that will see if in a caring environment they pick that up. But basically you have to have that in you. And that job, really they're the angels on earth in that sense, because they're the people that take care in that transition. We talked about preparing for dying. Those are the people, in many cases, are the people that, the people in the facilities are the people that the residents see most, even more than family.
Very close to that.
It's very, very close. It is like family. And so getting the right people to do that, and then there's a technical aspect. We're going to need more therapists. We're going to need care navigators. We're going to need more respiratory therapists. One of the big things is there. And we're not preparing properly for that. And again, it becomes an issue of what reimbursement is there, what grants are there, what education opportunities are there. And we have to look at that big picture. We're not.
Doctor, I want to come back. And listening to Phil, I think to myself, okay, so there are a whole range of primary care physicians out there.
Not enough.
Clearly not enough. We've done a range of programming on that subject. To what degree are you finding that there are a significant number of the primary care physicians we have, not enough, who are saying, this is a field that I want to learn more about. This is where I'd like to focus more of my practice, or is it something different?
I think it's something different. I think, across the country, geriatric fellowships are now, transitional programs between internal medicine residencies and family medicine residencies. There are 50% of those slots are unfilled each year. So we're not getting enough physicians. We have a difficult...
The demand doesn't meet...
Correct.
Or the need doesn't meet what's out there.
It's not a sexy type of profession.
It's not.
No.
Could it be?
It can be to an individual person.
Caring.
To the person who wants to, do open hearts and do surgery, it's not going to be that kind of profession for them. They're different personalities.
Perhaps a person who truly cares about making a difference. That's not sexy?
No. And it's
What
not.
is it?
And it's not highly reimbursable. And so
I mean, you're not going to get rich.
Correct. And particularly in New Jersey, where we lose about 50% of our residents that we train every year in the primary care specialty.
Okay, hold on. They're going to medical school.
Right.
They
Some of them
finish.
in New Jersey.
A high percentage we lose.
From the state, yes.
But if this field were to grow, opportunities were to be there.
The field has grown. People
The
see
need is there.
People see the field. People see the need. Sometimes people can't afford it. I mean, medical students now coming out of residency programs, $240,000
So the economics matter a lot
The
here.
economics matter a lot.
Some advice, I know you want to jump back in and say what you want to say, but I'm curious about giving some practical advice to family members watching right now and other caregivers, potential caregivers. Practical advice.
Have to sit down with your family, talk about the what ifs, and what
And also when.
And when.
Because
and what
my
does the
dad,
family
at a
want.
certain point, you couldn't have that conversation with him because the cognitive skills were not where they needed to be. We waited too long.
Right, and if you wait too long, then the person cannot sign a financial power of attorney or a healthcare power of attorney, a living will. And now you have to go into court, and that's an expensive process because now a guardian has to be appointed by a judge to take care of your parent, and it may not be the child.
What do you mean?
So sometimes the court, depending on circumstances, does not give guardianship to the child for the parent. So you could have a stranger making all those decisions for your parent. So it's vitally important to sit down while your parents still have all their mental faculties. If they won't have the conversation with you, see if they're willing to talk to a third party, talk to their physician, talk to an attorney, somebody, so at least the door can be opened and the conversation can start.
And what kind of emotional stress are we talking about in families?
Very, very high. And that part of what I was going to add to that is when individuals do find themselves in these situations of being caretakers, what we also know is it's important for the caretaker to receive some care on their own.
Break that down a little bit.
Well, they end up suffering from isolation because they're in the home, they're taking care of someone who may not even be very verbal, at least be good company, right? So if anything, maybe they're violent or they're so that caretaker now is in a role where they're isolated, and there are services, and I think that's the word we do want to get out. Most counties have services for families and caretakers, almost, affinity groups for them to have someone to talk to.
I don't want to make this too provincial because we've had these conversations off the air. But and I know my mom watches every program I do, whether they're good or not.
They're always good.
Thank you so much, Doctor. I appreciate it. To my mother, they are. To my wife, it's a different story.
It's true.
We'll talk offline. Every time we go to my mom, as we do this program, as I said, my dad's been challenged for about 6-7 years, I think now. And it's not verbal in that way. And my mom, I know she's isolated. I know she gets some help. But I'm like, Ma, let's go. Let's get out. There are only a couple places. She likes the track, okay? I'll say it publicly. She likes to watch ponies. Not that there's any parimutuel activity involved. But that being said, to get her out, to just get her out. Oh, I've got to be here. I know it's old school. I hate to say old school, and it comes from where she came from and what our family's like. And we're not the only ones.
No, not at all.
And so how do you talk to a parent who's like, no, I've got to be here?
There's nothing wrong with the fact that that's the way they grew up and that's the way they were.
But it is when you see the impact it has on the caregiver,
then
who
you
is your
have-
mother or your father or whomever.
But then you have to transition
It's
that.
not about our family, because I know we
But then you-
represent thousands of others.
But then you have to transition it to how the other person would want them to be. So I have this dialogue in the office all the time.
A few
with
seconds, go
families.
ahead.
And I think, you know, don't be afraid to have that discussion about what the other person would want you to do when they're gone.
It goes back to that issue of planning and addressing an issue. You know, as a
A few seconds, go ahead, Phil.
I just turned 65, so now I'm officially a senior citizen. I look at it from my own perspective, and I've been in this business for a long time. How am I going to plan for the next 20 years? It's a difficult thing, and I think you really have to look at it from the perspective of there is a process you're going to go through, deal with it, find the right people, find a care navigator, find a good physician that understands the process, find a good lawyer.
Don't wait.
Don't wait.
You've all helped a lot of people in the last half hour. I cannot thank you all so much. Thank you. See you next time.
The preceding program has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of CAUCUS New Jersey has been provided by New Jersey Sharing Network, the Northward Center, Valley National Bank, Delta Dental of New Jersey, the Port Authority of New York and New Jersey, KESSLER Foundation, and by Suez. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. CAUCUS New Jersey has been produced in partnership with TriStar Studios.
I could feel my lungs fill with oxygen, and I got my life back.
The Sharing Network means to me hope, life, and everything.
The Sharing Network was a lifeline to me when I really needed it.
We are an organ procurement organization.
The core purpose of the New Jersey Sharing Network is to save and enhance lives.
To honor those who gave.
Pay tribute to those who received.
Offer hope to those who continue to wait.
And remember the lives lost while waiting.
For the gift of life.